Hi, this is Jessica DaMassa, and I'm here with Lauren Steingold. She is the head of strategy for Uber Health. Oh my God, are we so happy to see you in healthcare. Hi, Uber.
Hi. We're happy to be here too.
Oh my gosh, so newly launched just at the end of last week. So give me a little bit of real brief. What are you guys doing?
Absolutely. So after quite a bit of research, we saw that transportation really is a barrier to care for millions of people across the United States. It's actually over 3.6 million people who missed a doctor's appointment last year because they didn't have a ride.
Right.
Uber has rides in spades, and we felt we really should be doing something to connect the dots there. So for the last year and a half, our team has been working on building a HIPAA compliant solution for healthcare organizations to request or schedule rides on for their patients to get to and from care.
That's fantastic, and we're so excited to see a company like Uber come into this space.
Yeah.
I mean, we were talking a little bit before about how we're starting to see more companies, more of the traditional technology companies enter into the space, Amazon, Google, Apple, and it's like we're excited to have Uber join the bunch, so thank you and welcome.
Yeah.
What do you think that, I guess, from that standpoint, you guys are learning in healthcare, and healthcare is so hard and it's frustrating. So what's your experience been so far?
Yeah, well, it certainly has been a long road for us, and honestly, that has been very much on purpose. We felt that it was something that we really wanted to make sure we got right. There's a lot at stake with patient lives in play. So for us, it really was about finding experts, talking to people who know the space, knowing what we didn't know, and really learning from them, and taking our time. For us, it was about how do we build a really robust HIPAA compliance program, and how do we make sure that we are doing everything we can to protect patient privacy and really get people to the care that they need. So taking time is key.
Yeah, so I'm going to flip it the other way, all right? So because like we're all looking for lessons that we can learn from outside of healthcare.
Yeah.
So as a company from Uber, what do you think that you guys can offer us? Like, what can we learn from you?
Yeah, I mean, I think Uber really, I'm sure, has played a big role in the on-demand mentality that a lot of people have, and I think the more healthcare can think about patients as consumers, the better. Think about what that experience is like. Do they have long wait times, or are they satisfied with the experience? And if you think about healthcare through that lens, I think really interesting solutions will come up that patients will be very happy with and excited about.
Is there anything here, I mean, this is your first HIMSS, so welcome. Is there anything here that surprised you about this conference? I mean, this is a really heavy health IT conference. This is about as health IT deep as it goes. So is there anything that surprised you so far?
It's way bigger than I ever imagined it would be.
Really?
I mean, we knew healthcare was an important industry and a lot of people cared, but seeing this many people in one place that care about the same things that our team is so focused on has been really encouraging and exciting. And really the willingness of people who are like, hey, I'm an expert in this area or in this area, let's work together and let's come up with some sort of strategic partnership, or let's collaborate to make exciting things happen in healthcare.
Okay, so we always complain in healthcare about how difficult it is to get anything done, how long it takes to scale things. We complain about lack of interoperability between systems. We complain about regulations. We complain about everything. So are we valid in our complaints coming in from the outside, or you're like, whoa, this is just as bad as they've said? Or are you like pleasantly surprised maybe?
Yeah, I mean,
you can be honest.
I think that like a lot of people who work in healthcare have also had experience as a patient, right? And so you can feel the pain point on that side where it's like, oh, I want to get my record from here to there, et cetera. Something we've been trying to do, and what we've built with Uber Health, the dashboard, is that we have a self-service sign-up flow. So a healthcare organization who wants to transport their patients can sign up for an account online and can get through that flow very quickly and start transporting patients within a day or so. And something like that, I think, is really great, because it's not, oh, we have months and months of contracts or long processes. It's let's try to streamline this and make it even easier. I'd love to see more of that in healthcare.
That is such an easy solution too. It's like you can sign up for it yourself. Like, oh my God, brilliant, right there, disruptive. Oh my gosh.
So that's the hope. That's the hope.
Okay, so we've been asking everybody. About their WTF Health moment, which means really two things, but most optimistically, what's the future? So, I mean, what's the future for Uber and health, you think?
Yeah, I mean, we are so excited to see what happens when ride sharing is in play in healthcare. The fact that transportation is a barrier to care when patients already have a million other things on their mind and so many to-dos that come into play with managing their own care, it's kind of crazy, Transportation should be the last thing on someone's mind. So we're excited about scaling this product, and there's, now that we have a HIPAA compliant platform, there's a lot of opportunity.
All right, I'm going to flip it the other way too. Okay, have you had a WTF moment here yet? Maybe not necessarily here, but even just in working in healthcare and your job and strategy.
Actually, I worked for some time at the Institute for Healthcare Improvement prior to my time at Uber, and I remember, and I was very young at the time, and I remember hearing, so many lives would be saved if doctors would just wash their hands. And I thought, wait a second, really? Like, I've been told that I should wash my hands my whole life. Like, how is it that we haven't been able to get there with doctors, people who are super smart and educated? So that really was a moment for me of like, if we could just implement that at scale, so many lives would be saved. So that was my personal WTF moment, yeah.
That's a good one, that's a good one. Lauren, thank you so much for joining us. We're again so excited to talk to you. Best of luck with everything and with your launch, especially this year, and we'll catch up with you again soon, I hope. All right, thanks so much. I'm Jessica DaMassa here with Lauren Steingold from Uber Health.